So in today's video, we look at why each one of us needs to know their blood pressure and how to control your blood pressure in case you find it too high, higher than normal. Hello everyone, welcome to my channel. Thank you for clicking. I'm Catherine Asimwe from Uganda, a candidate of a Bachelor's of Medicine and Surgery. Why is it that each one of us needs to know their blood pressure? You see, every time you have a heartbeat, a heart keeps pumping. So in every heartbeat, blood is being pushed out of the blood to all parts of the body. Yes, to the head, to the arms, to the legs, everywhere. And usually it pumps this blood via some vessels, some pipes. I would call them vessels here. And these are what we call blood vessels. So the force it uses to pump blood into these vessels is what we call blood pressure. Sometimes it pumps at a normal force, sometimes it pumps at a high force, sometimes it pumps at a low force. So for every normal human being, for anyone to maintain a good health, it has to continue pumping at a normal force. And how do we measure the blood pressure? Usually, this blood pressure is measured various equipment, automated and non-automated. And usually, we take two readings to avoid error, get an average, if possible, two differing clinical visits. And usually, you have to be relaxed. Yes, we don't want to take a wrong reading because you're from rushing. You have to be relaxed, seated, with your hand, at heart level. So seated straight with your legs straight on the ground. So we take this blood pressure. I get the average. And it should be falling within the normal range. So these are the ranges. So in case it's normal, very good. We expect now that you just maintain the healthy diet you're taking or normal physical activity that you've been doing. Then in case it's low, there's something not right, you need further evaluation. And still, if it's high, you need further evaluation. So why is it that each one of us should know their blood pressure? So you see, even when it increases, it's hard to notice. Like it shows unclear things, unclear symptoms which you can easily ignore. Things like fatigue. You could be tired on a tired day and you can easily ignore it. And yet usually the consequences of high blood pressure are very terrible. Things like stroke, things like your heart failing, the heart attacks. So all these things. So that's why we want everyone to keep measuring to at least every year. You can take a measurement of your blood pressure such that you keep in the know. If it's high, we start the treatment early enough. Now, someone could be wondering why would the force at which my blood is moving increase? So let's first compare this to a water, maybe if a water tank with some pipe letting water out. So anytime we have excessive volumes, the pressure at which the water is moving is most likely to be high, right? Yeah. And then also sometimes if we have any blockage within the pipe that is letting the water out, also there are high chances that it will increase. So the same applies to the heart. Every time we have excessive blood volumes, someone will be wondering. I expect high blood volumes to be good, not all the time. The blood volume should be controlled. They should keep in the normal. We should want normal volume, not excessive. So anytime we have excessive volume of blood, the pressure will most likely increase. And what are those things that increase the blood volume? Things like high salt intake. You see, even in the external environment, when you leave salt exposed, usually it tends to absorb water and becomes liquid. Even in our body, when you take excessive salt through the various processed foods, adding salt to our food, it absorbed more and more water. So there are high chances that you actually urinate very little urine because most of the water has been taken back into blood because the salt keeps pulling it back. And there are chances that you'll have a high blood volume that will increase your blood pressure. That's why even when you're controlling blood pressure, we start with telling you limit salt intake. It's because of this reason. When you take less water is retained, and so blood pressure is most likely going to go down. I hope that is clear. Then the other thing that can increase your blood pressure is if the heart is pumping faster than it should. Yes, there are chances that it will push out, it will act if it's pumping harder than it should, it will push out more than blood at higher force than normal. And some of the things that increase this is psychological stress. Things like stress. Stress is very common in our daily living. That's why we need to manage stress. Otherwise, stress alone can actually give you high blood pressure. Then, actually, stress, apart from increasing the rate at which the blood is pumping, it makes the body produce those some chemicals that even make the blood vessels to narrow. You know, the blood vessels are elastic, so they narrow down and become so small in that now pressure going through will be higher. The other thing that can increase blood pressure is in case we have resistance, like we saw in the pipes, in the vessels. In case you have any resistance, which are most likely going to have a high pressure. And what is the common cause of resistance? You see, anytime we have excessive fats in our body, they not only deposit below the skin, because most of us know them as depositing, under the skin, and you keep growing in body volume. It's not only that, they also go inside and deposit in organs. Yes, and sometimes even when they deposit in these blood vessels, our water pipes, they become narrower with time. They're more like rust would affect metallic pipes. Even these ones, the more they deposit, the more they become narrow. So with time, in a narrow pipe, of course, blood will flow at a very faster rate than normal. And what are things that increase fats in our body? Things like obesity. If you have a body mass index higher than normal, that is, the normal is 18.5 to 24.9. If you're overweight or obese, that is above 25 BMI, body mass index, there are chances that you have excessive fat building up in you. Then things like limited physical activity, you have fat deposits raising. Then the other thing also causes that affects blood vessels, making them limit, is aging. The more we age, unfortunately, aging is unavoidable. The more we age, the more our blood vessels become hard. So they are no longer elastic, so they become rigid, in that now blood will push at a higher force to go through. As we tend to age, chances increase of acquiring this blood pressure. Then also alcohol intake and tobacco. There are some chemicals in these particular substances that affect our arteries. Something called stenosis. Like with time, they also start, they affect the inner part of our vessels, and with time they start thickening and become more and more rigid and could give us high blood pressure. So those are the causes. With high salt intake, psychological stress, we've seen obesity and overweight, we've seen alcohol and tobacco intake, we've seen aging, then also sometimes genetics. If you come from a family where most of your relatives have hypertension, you are at high chances of also developing the same. Yes. So why what will tell you that actually you have high blood pressure? Unfortunately, high blood pressure is a silent killer. There are less chances that you'll actually know on any day until you get a complication. Blood will continue moving at that very rapid rate, that high force, until maybe the blood vessel ruptures, because sometimes it's like stroke. Blood vessels rupture, like blood vessels in the brain will rupture, blood pours into the brain, and someone comes with stroke when maybe one side of the body is completely weak. Unfortunately, it goes to those ends. Or sometimes you come when, the more the heart pushes blood to go at a high force, the more with time it gets exhausted and weakens. That's when now the heart fails, you get heart failure. Sometimes also, when the more the blood vessels thicken, now little blood is going through. That means even the various parts of our bodies are no longer getting enough of what they need, and some start dying off. Still also hear stroke, things like heart attack. That's how they come about. So how do you control your blood pressure? I've already hinted some of the things. In case you've been told by your doctor that you have high blood pressure, those are the ranges. They may differ. You may have just elevated, you may have stage 1, stage 2, and then stage the crisis where it's an emergency. So it depends. So in stage elevation, if it's elevated, you can just adjust your lifestyle, exercise more, eat more fruits and vegetables, limit the fats, lifestyle modification. Yeah, most chance high chance manage stress better, get these relaxation techniques all around. There are chances that your blood pressure will get back into normal. However, if it has one stage 1 and stage 2, there you need medication. And this medication is not self-administered. You need full assessment. Because before you started on some medication, we need to first know whether you're at risk of heart disease, you're at risk of stroke, such that adjustments are made. So there are various drugs available that can be done depending on individual characteristics. Then, in case of a crisis, like if you measure your blood pressure and it's up there, you need to wait 5 minutes, relax. Yes, relax. Wait 5 minutes, measure again. And then after now you measured, if it's still high, that's when now you meet the doctor as soon as possible. Yes. So other than the drugs, now even in stage one and stage two and stage three, still the other things I talked about still stand. Limiting your salt intake will reduce blood volume and help our force to go down. Then things like exercising, they will help the fats to keep on breaking down, and with time, you see every 5 kilograms you lose, it's equivalent to losing like 2 to 10 millimeters of mercury or blood pressure. So exercising more, then also having a more healthy diet, you know, avoid avoiding the alcohol and the smoking, and then managing stress better. And then you can also buy these automated blood pressure machines, and then keep monitoring the affordable ones, and keep monitoring your blood pressure. Make sure that it's never on any day too high for you, or such that. And then other than that, usually in the big first months you may need monthly evaluation by your doctor to see whether are we achieving the target, are we going towards normal, such that if you're going towards normal, we maintain you at that. If there is no achievement, either the medicine is doubled or you added some other drug to help you better, like that. Several adjustments keep coming up, as you go on. So basically, that's what I can talk about high blood pressure or hypertension. I hope this is helpful. Yeah, subscribe to the channel for more of such videos. Thank you.